Good morning, beautiful people. Good afternoon for those who will be watching in the afternoon, and good evening for those who will be watching in the evening. Should I say good night now? So, welcome back to my channel. For those who are new, kindly subscribe. For those who have subscribed, thank you so much. May God bless you. Yes, today we're going to do a very different thing. We've been doing waxing, some facial, and other things. Like I even did some filming, but today we're going to do something different. Not very practical, but you're going to do something different. We're going to talk about vaginal thrush. Yes, today we're going to talk about vaginal thrush. I know, like most of the ladies out there, they tend to suffer from vaginal thrush, and they tend to say maybe it's due to sexual intercourse or a different thing. Yeah, but I would like to tell you, like, somebody can have a vaginal thrush even if the person is not sexually active. There are different things that can cause vaginal thrush. People who are pregnant, they tend to get more vaginal thrush. People who are diabetic, when they have changes in their sugars, they can end up getting vaginal thrush. Yeah, and also when you are exposed to too much antibiotic, it leads to vaginal thrush because it tends to wash away all the bacteria that are important. The antibiotic washes away all the bacteria that are important in your body system, allowing the yeast to grow. And vaginal thrush is due to yeast. This yeast is like Candida albicans. It's one of the yeast that causes vaginal thrush. So when one takes a lot of antibiotic, it will lead to one getting vaginal thrush because the antibiotic will wash all the good bacteria in your vaginal system and allow the cyst to grow, meaning it gives the cyst the right environment for them to grow. It also changes the pH. Change in pH in the vagina also leads to or allows vaginal thrush. Yeah, so like, how do you know you have a vaginal thrush? You can know you have a vaginal thrush. Maybe there is itching around the vagina, there is clumpy discharge. Yeah, there is sometimes the discharge can just be normal. There is the inflammation around the vulva or in the inside lips, some vaginitis. Also, apart from itching, the inflammation and there is also that discharge. The discharge can have a weird smell. It can be smelly, and also in some cases it can also be normal. And there can be dysuria, whereby when you urinate there is some pain while urinating, or there is a painful sex, having sex in some cases, but it does not mean that all painful sex is vaginal thrush. No, it's just a sign. Maybe like you have these itching issues, some inflammation, then when you have sex you have some pain. At least you have like a lot of symptoms. They can be swollen lips of the chain. Yeah, so those are the symptoms. And when you have these symptoms, you can treat them at home. You can choose not to treat them if you don't have these symptoms. Let's say you've been tested, you have maybe you had gone for a different test, then you've defined cyst. Then you can decide whether to treat it or not treat it. And there can also be self-treatment. When you have these symptoms, you can decide to do self-treatment, whereby when you're doing self-treatment is meaning that you can go over the counter and buy the drugs. And the drugs, they come in 3 forms. You can either buy the cream, the colostrum, or you can go for the tablets, e.g. fluconazole or if it's not the fluconazole or the fluconazole tablet or the cream ones, you can also go for the one you insert inside, like it comes with something to insert. Yeah, there is I don't have a sample here, but maybe you people have seen it. Like this video, I just decided to prepare it, so I did not have these things. I just came up, I decided let me prepare for some people. Yeah, the paste is like it comes with something where you put the medicine and you insert it inside the vagina, and you press it, it sticks there. Or also some that they don't have that thing, you can take the drug that you are given. There are drugs that they dissolve, so you put inside the vagina and it will dissolve them. So that is the medicine you can go over the counter and decide to buy. And when it goes to cream, there can be there are two types. There is external cream and there is the internal cream. Now for external cream, you'll apply around the vulva and maybe around the lips of the vagina. Yeah, then there is the internal one. This is the cream that you will apply inside the vagina. Yeah, so even when you go for the cream, you have to know if it's external use or internal use. Yeah, or you have the series, or you're going for the tablet. So there are different type of antifungal that can be used to treat yeast infection. Yeah. Then if you're pregnant and you have vaginal thrush, don't ignore treating it. Don't go for self-medication. Go and see a doctor. If you have those signs and you're pregnant, go and see a doctor for a pregnant woman. Or if you're diabetic, you have to see a doctor. Or if you're having this vaginal thrush and you are over 60 years, you have to go and see a doctor. Don't do any self-treatment. Pregnant woman, over 60, and diabetic person, because there is this sugar levels issues in diabetic people. So you just go and see the doctor. Don't go for self-medication. Don't go for drugs over the counter. No, just go for proper medication from a doctor, because you can go for this medication whereby instead of helping you, they will end up worsening the situation for you. And at the hospital, what we do, if you have vaginal thrush, or if it's because you have this vaginal thrush, you'll be sent for a test. We call it HVS, a vaginal swab, whereby you'll be given something, or somebody will help you to collect some sample around the vagina. So they will use that to do some staining and check if you have the cyst. If you have the cyst, they'll prescribe for you the drugs. And it's the 3 types that I've just told you. Like it's either the one for tablet, the cream, or the pessaries. So it's one of them that is going to be used. Prevention of candid. Prevention of candid, it's by, you prevent candid by, one, like there is different ways to prevent candidiasis, but one for ladies, like even your inner underwears, you wash well, you make sure you hang them outside. Apart from that, also sexual hygiene matters a lot. Yeah, so some people, they're doing like anal and they come back and do the back and then in front. No, it's very wrong. You're not supposed to do that, because you contaminate yourself, and that is how even you can get vaginal thrush. And avoid antibiotics. As I said, too much antibiotic leads to yeast infection. So you avoid too much antibiotic. This will help you to avoid yeast infection, because not everyone that has yeast infection is very active, or is very active in sexual matters, or it's through that. Other cases also leads to vaginal thrush. Yeah, so but also people can get other vaginal issues which are not caused by fungi. Today I was just talking about fungi. They can be parasitic or bacterial, and I'll educate you on those ones another day. I don't want the video to be so boring and too long. So I'm so grateful for watching. Kindly subscribe to my channel. Be blessed. Bye bye.